Let's know more about cataract from the experts.
Hello, I'm Dr. Sreeni Edakhlon, cataract and glaucoma surgeon at Kannur and Kasaragod districts of Kerala. I take this opportunity to explain why cataract is such an important public health issue. Cataract is the leading cause of blindness in the world. In India, it causes 66% of blindness and 71% of severe visual impairment. So what is this cataract? All the youngsters will have a clear lens inside the eye, which helps them see clearly. But as they become older, say late 50s, 60, 70 years of age, the clarity of this lens deteriorates. As the lens becomes cloudy, it becomes less effective in providing clear vision. That is, the vision becomes poor. Formation of cataract inside the eye is an aging process, like graying of the hair, wrinkling of the skin that happens with age. It's not a disease as such. As a person grows older, the lens becomes more and more cloudy or opaque, and a stage will reach when it becomes totally opaque and doesn't let any amount of light through it or very little amount of light through it. Then that eye becomes totally blind. This stage is called mature cataract. This patient will definitely require cataract surgery at the earliest stage for visual recovery. Even before the cataract becomes mature, that is, when it is in the immature stages, even then the patient will experience difficulties in vision, like need for frequent change of glasses, gradual decrease in vision, glare, that is scattering of the light that you see around the bulbs, or halos, again, around the light or bulb, you see colored lights. So all these problems can be there when the cataract is immature. And the type of visual disturbance a patient experiences in the immature cataract stages depends on the type of cataract that he or she has in their eyes. Before explaining what are the different types of cataract, I shall try to explain what is the structure of a lens. The human lens can be compared to a grape, angur in Hindi or mundaringa in Malayalam. So just like a grape, lens has a covering or skin called the capsule. So imagine a grape there. So it has got a flesh inside, right? So inside the lens also, inside the covering, that is a capsule of the lens, you have the cortex. And like in a grape, you have those seeds deep inside. The deep inside the lens, there is an area called the nucleus. So depending on which part of the lens is become more cloudy, you can have nuclear cataract, you can have cortical cataract, or you can have posterior subcapsular cataract. See, this posterior subcapsular cataract, this is a very significant type of cataract because, see, even when it is very minimal, see, the vision might be okay. Say he might be seeing properly when the light is okay. But a patient who has a minimal amount of posterior subcapsular cataract, if he is driving a vehicle at night, when there is the headlight of the vehicle coming opposite, he will experience severe glare and he can become incapacitated, and this can lead to accidents. So same thing can happen when it is 12 noon and all, when the sunlight is so bright. So such a patient will require cataract surgery at a young age, maybe in the late 30s of 40, 45 and all, they will require a cataract surgery. Normally, we do cataract surgery when the patient is in the early 60s, 70s and all. But in this posterior subcapsular cataract, you will have to do a cataract surgery at a younger age. See, there are some other situations also in which a patient might require cataract surgery at a young age, like a patient who has an uncontrolled diabetes. The blood sugar of a diabetic patient, if it is not controlled, they will develop cataract at a very early stage. Early 40s, they'll have cataract. Or the patient has something like asthma, for which he has taken steroid treatment, they'll also develop cataract at an early stage, and they'll also require cataract surgery in their 30s or 40s. Sometimes you actually find children who have cataract, so this is called congenital or development cataract. It's a genetic condition in which we might do cataract surgery even at the age of 1, 2, 3, 4 and all. But you don't have to worry, because cataract surgery is probably the most effective surgical procedure. A patient who's totally blind undergoes cataract surgery. Say the patient has mature cataract and is totally blind. See, within no time, the patient will be able to see clearly if the retina is okay. So the cataract surgery has advanced so much. Like we have the modern day cataract surgery is called phacoemulsification, and there are a lot of advances that are happening. And once the cataract is taken out, it has to be replaced by an artificial lens. So there are a lot of technological advances in lens, which is called intraocular lens. It is called intraocular lens, which is going to be put inside the eye. So we have the latest generation trifocal lenses. So let's take an 80-year-old man who undergoes phacoemulsification and implantation of the modern day trifocal intraocular lens. He will be able to see almost as clearly as an 18-year-old youngster. So that is the efficacy of cataract surgery. But what I want you to understand is that if you are in your 50s and 60s and has a decrease in vision, it can be due to cataract, and it cannot be controlled or treated by eye drops, medicines, or spectacles. At one stage, it will require cataract surgery, and it is a very effective procedure. It's a painless procedure. So if you are in your 50s, 60s and all, and if you have a decrease in vision, please consult an eye specialist in your locality. Thank you for listening.
Act early, prevent early, driving change to defeat cataract.